He was premature, which was not unusual for any of our kids. He was taken life-linked within 24 hours, probably within 12 hours of him being born. He was life-linked to St. Paul Children's because he had bleeding on the adrenal gland, which is what they found, but they found a mass on the adrenal gland and in his stomach, and he had breathing issues. So he was in the NICU for 12 days. And then they decided that they were going to, he needed to be followed by a kidney specialist. And that's when we found out about the hemihypertrophy from the kidney specialist. And then when we talked to the nurse for the geneticist, she told us not to, just wait for your appointment in a month, come back in, and then we'll discuss everything with you. And how, as a parent, you can't do that. There's no way that you can be told that your child may have something and walk away and not look for information. She said, don't go on the internet and look it up because it's just going to scare you. Well, if you're not prepared and don't have the questions when you go in to see the doctor, you're not going to be able to get the answers to the questions that you have. They had discussions about Beckwith-Wiedemann syndrome in the NICU, but the discussions were not with us. It was already mentioned between the specialists. We found it in his records later, but they never said anything to us about it to begin with. We got to the point where we felt like we were over-testing him. We were going to the doctor every 3 months and having to take him up there and put him through all of that, and we just felt like it was too much for him, because he wasn't just seeing the geneticist for the hemihypertrophy and the ultrasound screenings. We were seeing the nephrologist, we were seeing the cardiologist, we were seeing the leg length specialist, we were seeing occupational therapy, we were going to the NICU follow-up clinics. I mean, we were going to the doctor all the time. It just was too much. We just felt like it was too much. And so we were ready to say, okay, we're screening this kid way too much. What's the sense in this? And then that following appointment is when they found the tumor on the right kidney. And then they did the surgery and they found the other 2 tumors and had to take portions of his kidney out, and then we went through chemotherapy. If we wouldn't have been screening him, he probably wouldn't have been found until he would have lost a kidney, or it would have ended up in the lungs, or by doing it this way, it was found when it was small and it was much more easily to treat. The screening protocols are put there for a reason, and even though we felt, that we were over-testing Wyatt, that you have to use those screening protocols. They're there for a reason, and they've been proven to work. And in Wyatt's case, he's a success story of the screening. Wilm's tumor is a very fast-growing cancer. It could have easily have cost him a kidney, both kidneys, because it was on both sides. Could have ended up in his lungs. We have a lot of friends that have families who have kids with Wilm's tumor. We have kids in every stage. We've lost friends to Wilm's tumor. Lots of them. It's very sad. If we wouldn't have screened him, he could be, a statistic instead of a survival story.